Kwekwe, Tanse, Ulukut. Hello, bonjour. I would first like to acknowledge that I'm speaking to you here today from the traditional territory of the Algonquin and Anishinaabe people. I am here today with Chief Medical Officer Tom Wong of Indigenous Services Canada and Associate Deputy Minister Valerie Gideon. They will offer commentary on any questions, but no prepared remarks. En date du 26 janvier, il y a au Canada 3508 cas actifs de COVID-19 dans les communautés des Premières Nations, dans les réserves, pour un total de 15 894 cas confirmés à travers le Canada et malheureusement, tragiquement, 144 décès. Je présente mes condoléances à tous ceux et celles qui ont perdu des proches et bon courage à ceux qui ont été touchés par ce terrible virus. Cette réduction des cas suggère que les mesures de santé publique plus strictes mises en place ont un impact sur la réduction de la transmission du virus au sein des communautés des Premières Nations. Nous devons continuer sur cette voie et travailler ensemble pour maintenir ces mesures en place pour assurer la sécurité de tous. I'd like to take this opportunity to express my sincere gratitude to Indigenous partners across the country who have displayed amazing leadership throughout this crisis and who know that now is not the time to let down your guard. Also, I want to thank foremost health practitioners, nurses, doctors, paramedics, researchers, administrators who've all played a central role during this difficult time and continue to show strength, resilience, and dedication through these 9+ months into the pandemic. To date, approximately 37,000 people across 196 Indigenous communities have received the first dose of the vaccine. I want to highlight some of the examples of the crucial work that's being done to meet the enormous challenge of getting vaccines into First Nations, Inuit, and Métis communities across the country. In Northern Ontario, the Orange Team has launched Operation Remote Immunity. They will coordinate the vaccination of members of the Anishinaabe Nation that are spread out among 31 remote First Nations, working with the support of the Canadian Armed Forces. Helping with this effort is Grand Chief Alvin Fiddler and his staff. They've been working with a team acting as a liaison between the communities and provincial health authorities. They've been coordinating logistics such as arranging for interpreters, drivers, and community organizers. In Yukon, territorial health authorities are using mobile vaccination teams. Team Balto and Team Togo, named after sled dogs, will be traveling to rural communities to administer the vaccines. They've been through extensive training to prepare and have already gone to Dawson City and Watson Lake. Before the teams arrive in communities, advanced teams will visit to provide information about how the vaccine program works and how they can get an appointment. On January 21st, the Nunavut government announced that 71% of the adult population had received the first shot of the Moderna vaccine. In Nunavut, vaccinations are well underway. The territorial health authorities expect that by early February, they will have received 18,000 of the 37,500, nearly half of allocated doses of the Moderna vaccine. So far, they've held vaccination clinics in Iqaluit, Rankin Inlet, Whale Cove, Arviat, Baker Lake, Greasy Fjord, Joe Haven, Igloolik, Chesterfield Inlet, and other locations. In southern Saskatchewan, First Nations communities have begun to administer vaccines. So far, over 4,000 people have been vaccinated. Indigenous leaders in the province have recorded public service ads to educate their communities about the vaccine to reduce hesitancy. One example is Peter Ballantyne Cree Nation's Chief Peter Beattie, who shared his message mostly in Cree, describing how he had received the vaccine. In Manitoba last Friday, approximately 1/3 of the 5,300 Moderna vaccines allocated to Manitoba First Nations arrived at Island Lake. Au Québec, environ 10 680 vaccins ont été administrés dans 22 communautés. Dans les centres urbains comme Montréal, des cliniques de vaccination ont également été mises en place pour la population sans abri, en grande partie d'origine autochtone. The logistics of a COVID-19 vaccine rollout require coordination among partners in provinces and territories. An efficient and effective rollout requires co-planning and is dependent on full collaborations of provinces and territories. I want to stress once again that both on-reserve and urban Indigenous populations must be prioritized. There's also been an outpouring of support for communities dealing with the culminating effects of the pandemic. For example, in Toronto, Anishinaabe Health have adapted to meet the needs of their clients while maintaining recommended public health measures. They've moved many of their services online, such as diabetes prevention. And they're also using an RV and a van to meet isolated and vulnerable communities throughout the city. They've been providing COVID-19 tests, as well as information so that clients can access health services such as counseling and primary health care. These are just some examples of the initiatives healthcare practitioners have taken to get us through these challenging times. Despite the advances that are being made, I want to address an issue that is on the top of many minds, and that is the reduced shipments of the Pfizer vaccine. While this has caused temporary delays in rollout of vaccines across the country, production and distribution will be back to normal levels by mid-February. Even with the temporary delay, we can confidently say that every person in Canada who wants to get vaccinated will have the opportunity to do so by the fall of 2021. This is a race to get the last person vaccinated, not the first. I'd also like to quickly note that there have not been any delays for the Moderna vaccine, which is widely, as you well know, being used in the North. While the introduction of the vaccines and all of the progress that I've given you examples of are incredibly encouraging, and we should feel that we're rounding a corner, we're not at the end. We could, however, think of it as the beginning of the end. Widespread immunization is one of the best protections against COVID-19, but in the meantime, we need to maintain the focus on public health measures. Social distancing and self-isolation, however, are simply not possible for many families, a serious shortcoming at a time when COVID-19 is taking a tremendous toll on the mental health of people and sometimes fueling increased acts of aggression and violence. I recognize that the longer the pandemic drags on and the stricter the lockdown becomes, the more dangerous the situation is for women and children at risk. It's precisely why we announced last May that we'll invest $85.6 million over 5 years and $10.2 million ongoing to build a total of 12 new shelters to help protect Indigenous women and children fleeing violence. This includes 10 to support First Nations communities and 2 new shelters in the territories. It brings the total of Indigenous Services Canada funded shelters to 58. But we know there is a need for Inuit-specific shelters. We've listened to Inuit partners, and in November's fall economic statement, we announced $724.1 million over 5 years to launch a comprehensive violence prevention strategy to provide Indigenous women and children greater access to places of refuge when escaping violence. Through these investments, we are planning to fund 5 shelters specifically for Inuit. They will be across Inuit Nunangat, as well as in urban centres like here in Ottawa, in order to support Inuit women wherever they are in Canada. And I want to highlight the advocacy of Pauktutit in getting this done. Throughout this pandemic, people have been pushed past their limits. Our society has been going through a harrowing ordeal, and we've much to learn from Indigenous communities who've been resilient throughout all the injustices they've endured, and their resilience throughout this pandemic has also been unwavering. Plus tard, aujourd'hui et encore demain, je participerai à une importante réunion pour discuter du racisme anti-autochtone et du racisme systémique dans les systèmes de santé. J'aurai l'occasion de continuer à apprendre des dirigeants autochtones qui demandent et méritent des soins de santé plus justes et plus humaines. Ce deuxième dialogue national portera sur les mesures concrètes que les organisations autochtones et non autochtones impliquées dans des parties clés du système de santé canadien sont prêtes à prendre pour éliminer le racisme anti-autochtone. Les gouvernements provinciaux et territoriaux sont également invités à parler du travail en cours dans leur juridiction et des changements qu'ils s'engagent à implanter à l'avenir. Merci, miigwech, nakumek, and thank you.
Merci. Nous allons maintenant répondre aux questions des journalistes. Une question du suivi. We'll start with 3 questions from the phone. Operator, over to you.
Thank you, merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. The first question is from Christy Kirkup, the Globe and Mail. Your line is open. Please go ahead.
Hello, good morning. I'm wondering if you can also please speak to the meeting that's happening today, Minister, the follow-up meeting on systemic racism in health. And I know this is a discussion that will be playing out for a couple of days, and the federal government can't be the only level of government involved in pulling levers on this. But what do you see being the measure of success in this meeting?
Well, Kirsty, it's over 2 days, today and tomorrow. I don't want to presume the outcome because we have a lot of work to talk about on the phone or on Zoom or however we're doing these meetings these days. We know going into the meeting that there is racism in the healthcare system. There's systemic racism in the healthcare system in every province and in every territory. We know that it is false to say that the federal government has no role to play in the health of Canadians. If anything, this epidemic has shown us as much. We also know that this is a jurisdiction that is jealously guarded by provinces. But when it comes to issues like racism, systemic racism, discrimination, every leader in this country has a leadership role to play in calling it out and getting rid of it. There are many things that can't be solved overnight, the structural changes that need to be addressed. Many of them fall squarely in what Mary-Ellen Turpel-Lafont, who will be participating in the meeting, has identified in her report in BC. We know that the horrendous events, I had a chance to speak to Grand Chef Constant Ouachiche, Chef Paul-Émile Ottawa from Manawan, where Joyce Echequan came from this morning about their leadership role that they plan to play in highlighting the important impact of Joyce's principle, which touches in part on principles of equality, equity, and fairness towards Indigenous people who have all often and still get treated as second-class citizens in what we believe in Canada to be a first-class healthcare system. So there are many facets of this. You asked a specific question about what a measure of success of this meeting is, and I can confidently say that I don't know yet. I want to give the opportunity for people to talk, to speak, for our people to participate. What I do know as leaders, when we call out systemic racism and racism in the healthcare system towards Indigenous peoples, that we can call it out, but Canadians often get frustrated at politicians that simply call things out and then don't do anything afterwards. So I think Canadians will expect concrete answers, concrete measures, and we know where some of those lie going into these. There have been many reports. You look at the Vienne Commission report that talks about the interplay of the federal healthcare system on reserve, its link to provincial healthcare systems off reserve, and how that has to get better. So, you know, there is a specific role in our jurisdiction to play. It doesn't absolve provinces and territories from recognizing that systemic racism exists. It is the lived experience of many Indigenous people on a day-to-day basis as they apprehend the healthcare system and normalize treatment that is unacceptable. So I think a measure of success is coming up with a joint plan as Canadians to hold ourselves up to the standards that we have set for ourselves, and recognize that in some respects we are failing, but we can meet them together as a country.
And just as a follow-up, Minister, I know that I have asked about this matter before, specifically calls to add an additional pillar to the Canada Health Act, and I appreciate this is something that also would be, under the purview of the Health Minister. But there has been increased advocacy around this, specifically an open letter with thousands of signatures now, and from a number of organizations calling for the federal government to include specifically an anti-racism pillar in the Canada Health Act. Has there been, the last time I asked you about it, any additional thought with regards to that lever that could be taken by the federal government?
Well, it'll be a really large memorandum to Cabinet, Christy. I can guarantee you that, and I don't know what it'll contain. Frankly, I'm attracted by the idea. I also know the mandate that the Prime Minister gave me to develop distinctions-based healthcare legislation. That requires a heck of a lot of diligence across the country, engaging with treaty partners to understand the needs in healthcare and what needs to be done. Whether that then includes amendments and specific legislative instruments, I don't want to, again, presume that is necessarily the ultimate path that we take. Certainly, we know where some of the problems are, and we know where that we need to act federally. But again, and you may recall we announced about $16 million in the fall economic statement to support the development and the beginning of the diligence process and outreach process of distinctions-based healthcare legislation, which will require engagement with treaty partners, with Métis, with Inuit, and that engagement is key to guiding that outcome.
Thanks, Christy. Next question, prochaine question.
Thank you, merci. And once again, please press star 1 if you have questions. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. La prochaine question est de Julie-Anne Lapointe, Radio-Canada. À vous la parole.
Oui, bonjour. J'aimerais vous entendre peut-être en français sur la réunion, justement. Si je comprends bien, on parle d'un dialogue pour l'instant sur le racisme systémique. Est-ce qu'on, déjà, on s'attend à des propositions de solutions? On en est où, en fait, dans les étapes?
Bien, je vais essayer de ne pas trop me répéter en français de ce que j'ai dit en anglais, mais il va falloir que je reprenne quelques points. Évidemment, nous savons que le racisme anti-autochtone, le racisme systémique existe dans le système de santé à travers le Canada, à travers toutes les provinces et les territoires. Prendre acte de cette réalité est un pas en avant. C'est important que toutes les provinces et tous les territoires reconnaissent autant. En ce qui a trait aux rencontres qui vont se dérouler au cours des 2 prochaines journées, je sais que beaucoup demandent des plans d'action. Ce serait, selon moi, un acte d'arrogance envers ce qu'on se doit d'écouter durant les 2 prochaines journées par les gens qui vivent cette réalité au quotidien ou qui ont travaillé dans le domaine et qui ont des pistes de solutions et qui demandent l'appui du fédéral en tant que leader. Comme je l'ai dit en anglais, c'est faux de présumer que le fédéral n'a aucun rôle dans le système de santé et en ce qui a trait à la santé des Canadiens et la COVID-19 et l'intervention massive du fédéral en termes d'appui financier, surtout aux provinces, aux territoires, en témoigne autant. Mais là, il reste que, ici, nous parlons de racisme systémique. Au Canada, on a un système de santé qu'on se veut de première classe qui traite les Autochtones souvent comme des citoyens, deuxième, même de troisième classe dans certains cas. Et évidemment, ce qu'on a tous vu témoigner, qui nous a tous interpellés au courant des derniers mois, c'est-à-dire le décès tragique de Joyce Echequan, est un exemple, malheureusement, pas le seul, qui vient nous renforcer le fait que trop souvent les Autochtones non seulement sont maltraités dans le système de santé, provinciale, territoriale, mais c'est une situation au quotidien que les gens normalisent et que c'est inacceptable dans une société aussi avancée que le Canada. Ça va prendre la participation des provinces, des territoires. J'ai eu l'occasion ce matin de parler au grand chef à Washish, au chef Paul Émile Ottawa pour parler de leur rôle, pour continuer leurs revendications en ce qui a trait au principe de Joyce, c'est-à-dire prôner l'égalité réelle des peuples autochtones dans le système de santé. C'est un projet de moyen terme pour eux, mais je veux que cette communauté, ils veulent exercer un certain leadership en ce qui a trait au principe de Joyce qui devrait, selon moi, s'appliquer à l'entièreté du pays, parce qu'on parle d'abord et avant tout de la santé et de la sécurité, mais aussi de la dignité des peuples autochtones. Donc, je ne vous dirai pas qu'il y aura un plan d'action à la suite de ces 2 jours. Il y aura surtout des pistes de solutions axées sur l'action. Je sais que beaucoup de Canadiens entendent les politiciens dénoncer, interpeller, mais je pense qu'au final, ils veulent des actions concrètes et c'est quelque chose qu'on va viser. Une des actions, par exemple, c'était l'annonce hier en compagnie de Pauk Tutit pour les refuges pour les femmes et les enfants Inuit, pour leur protéger et surtout, évidemment, durant la COVID où les gens sont plus confinés. Donc, on peut le constater, les statistiques à l'appui, une augmentation de la violence envers les femmes et les enfants. C'est un bon exemple, mais il y en a bien d'autres qui nous seront proposés et qu'il va falloir agir non seulement au niveau fédéral, mais au niveau provincial et territorial.
Merci, Juliane. Avez-vous une question du suivi?
Oui, s'il vous plaît. Sur la vaccination, maintenant, on sait que dans les dernières semaines, il y a des communautés autochtones, surtout plus éloignées, là, qui attendaient toujours des livraisons de vaccins. J'aimerais savoir, on en est où avec ça? Est-ce que, par exemple, les retards de livraison Pfizer, ça peut avoir des conséquences sur les communautés plus éloignées? Est-ce qu'on en est aussi à voir s'il y a moyen, par exemple, s'il y a une possibilité aussi avec ce qui se passe avec l'Union européenne, que là aussi, ça puisse poser problème?
Bien, la réponse, règle générale, non. Évidemment, parce que les territoires, les communautés éloignées ont préconisé la solution du vaccin Moderna, évidemment, plus facile à utiliser, manipuler dans des températures qui ne sont pas aussi extrêmes que les conditions dans lesquelles le vaccin Pfizer doit être utilisé, administré, manipulé. Donc, la réponse générale, c'est non, mais il y a des nuances. Si les provinces, les territoires commencent leur repriorisation, commencent à regarder la distribution du vaccin, voilà, l'inquiétude que j'ai, c'est envers les peuples autochtones et une certaine marginalisation de la priorité qui devrait leur être accordée, étant donné la science sur la vulnérabilité de ces peuples, qui montre que les communautés autochtones sont 3,5 à 5 fois plus susceptibles à contracter la COVID. Si on regarde les chiffres, évidemment, qu'on peut apercevoir, qu'on peut voir aux États-Unis, par exemple, c'est une question de science et non de politique. Alors, évitons d'insérer un discours politique dans quelque chose qui devrait être administré par des experts en épidémiologie, en santé publique. Il reste aussi que le vaccin Pfizer a été administré et offert dans certaines communautés autochtones dans le sud du pays. Évidemment, il y a un effet évidemment d'entraînement dans la mesure où il y a une réduction des vaccins de Pfizer. Nous sommes toujours optimistes quant au canal de distribution qui existe, qui nous a été assuré par le leadership de Pfizer et de Moderna à la fois, évidemment, et l'optimisme qu'on a envers l'approbation d'autres vaccins potentiels. Je passerai aussi la parole, parce que c'est une question de politique, de priorisation de santé, mais aussi de logistique. Dans le Nord, si vous avez vu les reportages, il y a des efforts incroyables qui ont été déployés pour immuniser ceux qui sont les plus vulnérables, qui parfois doivent être transportés de longues distances pour avoir du traitement de base. C'est une question de logistique autant que c'est une question d'accès au vaccin en tant que tel. Donc, je laisserai un peu la parole à Valerie Gideon pour vous donner plus de détails là-dessus.
Il n'y a pas beaucoup de plus de détails que je pourrais donner. C'est une excellente réponse. Je pense que c'est vraiment travailler ensemble en partenariat entre les partenaires autochtones et les provinces pour s'assurer que la planification tient compte de ces questions-là, de comment est-ce qu'on peut maximiser nos efforts pour rejoindre les populations qui sont prioritaires selon les conseils qui ont été fournis par le Comité national sur l'immunisation. Donc, s'assurer qu'on minimise essentiellement des impacts sur ces populations qui sont prioritaires-là et travailler vraiment ensemble sur les solutions, les pistes de solutions concrètes, comme le ministre a dit. Mais nous avons l'espoir que vraiment les communautés éloignées vont être continuées à recevoir le vaccin et qu'ils vont continuer à vraiment pouvoir avoir la réussite qu'ils démontrent déjà au niveau de l'administration de l'immunisation dans leur communauté.
Merci. Nous allons prendre une autre question par téléphone, ensuite les questions dans la salle. We'll take one more question over the phone and then questions in the room.
Merci, thank you. The next question is from Jamie Pashagumskum, APTN. Your line is open. Please go ahead.
Hi, thank you, Mr. Miller, for taking our questions. You mentioned that you're hoping to have all Indigenous people who want the vaccine vaccinated by fall of 2021. The Prime Minister has stated time and time again that he wants everybody in Canada vaccinated by September 2021. I'm wondering if there's some discrepancies here and where your expectations are for vaccinations.
No, I probably conflated fall with September, so that's just me, Jamie. In fact, when we're talking about Indigenous peoples, and I think I've said it time and time again, and I continue to say it, and I will continue to say it because the science points us towards it, is that, if anything, the science is saying that the priority needs to be given to Indigenous communities, whether you're talking about northern and remote communities for which the territories and provinces are deploying incredible efforts to vaccinate 75% of remote, and essentially, when we're talking about remote, more often than not, we're talking about Indigenous. But clearly those populations have been established, and we've mobilized resources to get them vaccinated first, so 75% of the territories by the end of March. Tom, looking to Tom, that he says that's right, so both doses. And then when we move into phase 1B and 2 of the rollout, and the more large deployment of the vaccines on a volume that really still requires a level of prioritizations, we start focusing on I guess, quote unquote, southern communities, continue the emphasis on highlighting the vulnerability of Indigenous communities in urban environments. I saw a letter from Natan Obed with respect to Inuit communities living in urban centers, urging premiers to prioritize those populations because of their vulnerabilities. I think people are listening. But with scarcity sometimes comes political reflections and politically expedient solutions. What I said to one of your colleagues in French is equally true in English. This is not a political game. This is about science. It's about facts. It's about healthcare. And we know that Indigenous populations, we have the numbers, we have the casualties to prove it, are 3.5 times to 5 times more vulnerable to COVID. We see it. We see it with the CDC numbers in the States. Those are the odds that populations living in Canada are facing as well, and they are fighting against them every day. So when we talk about timing and vaccine deployment, every day counts. And I conflated September and the fall, but Indigenous populations across Canada should be vaccinated well before that, and that is what I will keep pushing, and that we will keep pushing as a government, because that is where the science is porting us towards.
Thanks, Jamie. Do you have a follow-up?
Yes, I do. Thanks for the clarification, Taylor. You also mentioned your commitment in May to build 12 shelters. I wonder if you have any details on how that's going.
Do you mean on the locations, Jamie?
Yeah. Well, are they built?
Well, we're working. Well, this is a process that's going with us through CMHC, so the commitment is there, and we'll be working with our partners to finalize the locations and the details. I would also highlight that it's another of the Indigenous Services Canada committed to shelters. That's only part of it. And what I was trying to highlight, I think, was yesterday's announcement with Pauktutit that we will be working with them for what they've been advocating for so long on behalf of Inuit women to build an additional 5 shelters, one of which is proposed to be in Ottawa, given the numbers of Inuit populations here. But 4 additional ones in Inuit Nunangat.
Thanks, Jamie. Mackenzie, would you like to go ahead?
Hi, Mr. Miller. Mackenzie Gray with CTV. I'm sure you've seen the stories online of the couple who flew to the Yukon to get a Moderna vaccine. I'd like to know your opinion on that and what you think should happen to those people who did that.
That was maybe the dumbest thing I've seen in a long while, Mackenzie. I don't know what was going through those people's minds. As White River First Nation, I think that they've flown into. I think the community made them walk back to the airport. I read that somewhere. I'm disgusted. We've said time and time again to Canadians, there is a prioritization. Canadians expect the healthcare system in Canada to be fair. I think a lot of people are willing to wait to see the elders and Indigenous peoples vaccinated, those that, or those that need to get vaccinated first are willing to do that. It's something we pride ourselves in, Canadians. It's part of the reason why people, I think, are compelled by some of the meetings we're having this afternoon on racism, systemic racism in the healthcare system, because people see it as patently unfair, and they want answers, they want solutions. That was the most idiotic thing I've seen in weeks. And there's lots of stuff on the internet that rises to that level. So I don't know, but that's a community. I don't know. I understand these people are wealthy, and I won't tell them what to do with their money. But perhaps reparations are due of some level, and there's certainly a gesture of individual reconciliation and contrition that can be exercised, and certainly communities in need like White River First Nation would more than appreciate that. And if anything that I've learned over the last year as Indigenous Services Minister, Indigenous people are extremely forgiving people if you make the overture.
It's my understanding that these people, despite not living there, actually got the first shot. broadly speaking, are you concerned that there isn't potentially enough identification needed or any other measures in place to make sure that the people who are getting the vaccines or people who should get the vaccines in the territories are the people who are actually getting the vaccines?
Yeah, I think given, we're making kind of wartime decisions on the ground, and I'm not going to presume what the healthcare workers did or didn't do. I think everyone's putting in their best efforts to get those who they feel should get them. And if there was a mass vaccination effort and someone successfully gamed the system, I don't think it should be on the backs of the people that are doing the incredible work on the ground. Obviously, tracking and tracing of who's getting what is key from a health perspective. You're talking a situation where there's extreme scarcity of the doses, and some people, for whatever reason, trying to game the system. They shouldn't do it. It's dumb. It's wrong. It's unfair, and I think there's some personal reflection on these people's that these people need to go through. So I'll try not to point fingers, other than these two individuals that I really don't want to talk about anymore.
Thanks, Mackenzie. Olivia, would you like to go ahead?
Good morning, Olivia Stefanovich, CBC News. How willing, in your view, are the provinces and territories to actually implement policy changes and take the measures that are needed to prevent racism against Indigenous peoples in the healthcare systems? And what will you do to prevent jurisdictional squabbles?
Yeah, I mean, Olivia, if anything, we've seen at the federal government, and particularly with respect to Indigenous peoples, is jurisdictional squabbles are often had on the backs of Indigenous peoples. They're first to pay for it. It's the whole principle underpinning Jordan's principle. Does not escape me when we look at principles that are being advanced. On Joyce's principle, we know I mentioned it, I believe it was in French with respect to the Vienne report that talked about the interplay between the federal healthcare system and the provincial healthcare system. That those jurisdictional squabbles can result in prejudice to Indigenous peoples. This is what we talk about when we talk about outcomes and systemic racism. And yes, we talk about individual incidents that are egregious, but we also talk about the cumulative impact on Indigenous peoples that are disproportionately affected by those outcomes. I think it's the shock everyone has when people refuse to look at the facts and say these are the outcomes and recognize that they are disproportionately impacting Indigenous peoples. It doesn't change the fact that these individual incidents add up to a trend, and in fact, it's those trends that we're trying to address with provinces. It's the reason why I think my utmost. We do our utmost not to call people out, because I think there is goodwill. I know Quebec has not acknowledged the existence of systemic racism. I think that is wrong. But they have also taken steps to work with the community, in particular in Manawan, with Indigenous communities, to start addressing some of the egregious things that they've noted in their sphere of jurisdiction. So I don't want to squabble. I think we all should recognize as Canadians we have a role with respect to leadership to call out racism, systemic racism. We all have a role within our respective jurisdictions, and I've highlighted a number of elements that fall squarely on the shoulders of the federal government. But this is something that, given mostly issues in and around transfer payments and the evolution of the healthcare system, that we've seen jurisdictional squabbles. In this case, when it comes to Indigenous peoples, it's often with Indigenous peoples that pay the price. So I don't want to be calling out provinces or territories. I know that we all want to be held up to the standards that we identify as elements of who we are as Canadians. But that's what we will continue to do. And a lot of the work is done quietly with officials to ensure that while we exercise leadership in respect of calling out and working towards weeding out Indigenous racism, giving voices to those who have that lived experience, that there is a process of reform inside the healthcare systems, and even those healthcare systems and provinces that we look at and say, hey, these guys are doing a great job with respect to reconciliation, Indigenous rights recognition, such as in BC, that it still occurs. So there's work to do everywhere.
Ontario Senator Yvonne Boyer is suggesting that Ottawa create a task force to look at enforcing financial sanctions through the Canada Health Act to make sure that the provinces and territories address this issue. And they will face financial penalties if they fail to act. I'm wondering if this is something that you will commit to.
No, I have immense respect for Senator Boyer. I spoke to her recently. We text often. She's a fierce advocate for the things that she believes in, I'm frankly enriched as a person for having discussions with her. I don't agree with her on this point. This is not a time to be holding back money as a threat, particularly during a pandemic. Maybe convince me otherwise in a couple months, but I don't think it's the right approach. I think there are many, many more carrots than sticks out there that we haven't really examined. And this is one where we really have to exercise a spirit of cooperation. I think the spirit behind what Senator Boyer is advancing is the right one, which is weeding out racism and systemic racism. I think it is an expression of being fed up with certain provincial instances, and I get that. But I think she will agree with me when we say that we've got to work together. But I don't think financial restrictions are the right way to go.
Thank you. Next question.
Good morning, Minister. Jordan Press with the Canadian Press. I want to ask you just about, you talked off the top about the need to prioritize Indigenous peoples, urban, in nations, to make sure that they get vaccines. You talked about how this isn't about politics and you don't want to get into squabbles, but it seems that you're in one. So can you just lay out what exactly is the hurdle that needs to be overcome for Indigenous peoples in this country to be prioritized for vaccines as you're hoping that they will be?
Yeah, Jordan, you've touched on a number of points. I think we could go on, I certainly know I can go on, but I could go on at some length about first recognizing that Indigenous peoples are vulnerable, looking at the numbers that we see. We all knew going into this pandemic, based on our experience with H1N1, hospitalization rates, impact of H1N1 in communities, some of the initial deployment of the vaccine that could have been better, and obviously some very sensational stories going out about body bags into communities. Just the lack of prioritization and concern that seemed to be prevalent. So it starts with the recognition that Indigenous peoples are vulnerable to it, and then the question is why. What has become obvious through any communication I've had with the chiefs that have seen real exponential spreads of COVID in their communities, people dying, is the first conversation. If it's not about COVID, it's about housing. We know that from our experience with overcrowding in the north. Spread of tuberculosis is caused. One of the highly causative correlative factors is overcrowded housing. It is a vector of spread. It's no different in many Indigenous communities, and this being a respiratory disease, it's same sort of propensity to spread in crowded conditions. We see that. We see that in any community that has one or two cases. That person comes from a 15 or 20 person household. We've had a case where 19 out of the 20 have become infected with COVID, so I can measure that. We know what's going on in the U.S. We've seen devastation in Indigenous communities that have some of the same socioeconomic conditions, the same social determinants of health that create those negative outcomes. So that recognition is important, because once you recognize it, you can start looking at what the solution is. So resources and infrastructure from the very beginning, we've said to our federal, provincial partners that we have shared jurisdictions in healthcare, sometimes primary when it comes to the federal government. We're going to put all resources to bear in those that are more vulnerable. We look at the guidance. I look for guidance from people to my left and to my right who tell us what to do and what to push for. Dr. Tam has pushed for as much as well. So you look at the NACI guidelines, and they tell us about, they're very general, obviously, but they tell us where to deploy the vaccines. And we've seen, I'm looking at the numbers as they roll in, and we've seen that prioritization of Indigenous populations in northern communities reflected in the vaccine rollout, even with all the logistical challenges that we have. Where it then becomes more complicated is the interplay that you alluded to between provinces and territories, where we have to actually sit down with some of the health officials, with doctors, and with Indigenous leadership, health leadership, to say, well, is a long-term care facility really an apples-to-apples comparison in an Indigenous community? It's very possible that in an Indigenous community, there is no long-term care facility, so the vulnerable person is an 85-year-old grandmother living with 10 other people, or 5, 6 other people. And that vulnerability, I would argue, is even higher. So that's the sensitization that we have to get through to provinces as we share that responsibility of deploying the vaccine. We've seen that in a number of our tables with provinces, willing to reduce the age at which a certain group of individuals in Indigenous communities would get vaccinated. That's a reflection of some of the work that's been done at these trilateral tables with provinces, and we want to continue that work. And you get into more complicated deployment challenges when it comes to the urban Indigenous communities, which do obviously seeing some of the spread that we've seen, for example, in Winnipeg and Montreal and in Toronto and Vancouver, and sometimes with the homeless population, knowing that we got to sort of adjust our fire and say, hey, these people now need to get vaccinated. That's work that's ongoing. It's evolution. No set of guidelines will be perfect, and they will vary from province to province, but it's just work that's all being done in the background with our officials to get it done. And you know, I think essentially, I mentioned it perhaps I think it was in French, but when you start to talk about scarcity of the Pfizer vaccine, you start to see a political dialogue get inserted into a narrative that really needs to stay at the health level. And that's my worry, because it's often on the backs of Indigenous peoples. And that's why we just got to keep moving forward with provinces and territories as we get into the larger deployment of mass vaccination and ensure that the priority populations get vaccinated, not only for the health of those individuals in question, but also the fact that they themselves can become bigger vectors and become a bigger burden on the healthcare system. And the best numbers that we have with respect to that burden on the healthcare system are coming out of some excellent work that's being done in Manitoba. And we've seen that disproportionate number of hospitalizations with respect to Indigenous peoples, not only in the hospitalizations themselves, but in the ICUs.
So just to follow up then on, particularly because you mentioned urban Indigenous and some of the complicating factors, because they are disproportionately, they're disproportionately represented amongst, for instance, the homeless population in many urban centers. So as far as those guidelines, can you give us an outline of what the guidelines are at the moment going to be looking like, and how you then make sure that, for instance, when you have a large homeless population that is disproportionately Indigenous, how you make sure that they also can receive the vaccines when it may be tougher to get to them?
Well, I can tell you at a general level, and I think Tom, do you want to talk about some of the guidelines and some of the work you're doing with provinces to kind of adjust within? Tom will talk a bit about the technical aspects of ensuring the guidelines do reflect what the science is telling us. Jordan, what we have said to provinces is, what do you need? Do you needles, swabs? Tell us what you want. Tell us what you need. Do you need our assets? Do you need the Canadian Armed Forces? If there's a job, you want to free up some of your assets, we have the resources of the Canadian Armed Forces to assist. The logistical power of that is unmatched. We'll say that to provinces, and if they need it, we're there to help. And that's work that I'm doing with the Minister of National Defence to say that when there is a need expressed, we will fill it, and really leave no options sitting on the table. Tom can talk a bit more about the guidelines and how they match with provincial priorities.
Thank you so much. As Minister just said, there are large groups of underserved population in urban centers, and this must not be forgotten. We know that provinces and territories need the help, and the public health officials within the federal government, are here to help provinces and territories, such as in the recent situation with Montreal, launching a vaccine program targeting the underserved homeless population in Montreal, and supported by the federal government. In addition, to that, there are places such as in Toronto, such as in Vancouver, such as in Winnipeg, across the country. There are extensive discussions right now in place in order to look at, how provinces, can be supported in order to reach out to the underserved population in inner city. One of the things that so important is that people tend to think about, this is a problem just of the north. the north remote and isolated areas, as per the National Advisory Committee on Immunization said, it is extremely important, needs to be prioritized. But equally, the National Advisory Committee on Immunization also talks about the racialized, marginalized population in urban centers, including First Nation, Métis, and Inuit. Thanks.
Thanks, Jordan. We'll take another question from the phone. Une autre question par téléphone, s'il vous plaît.
Thank you, merci. La prochaine question est de Émilie Bergeron, agence QMI. À vous la parole.
Oui, bonjour. Une question pour le ministre Miller. Vous avez dit tout à l'heure en réponse à une autre question que c'est important que toutes les provinces reconnaissent l'existence du racisme systémique dans les systèmes de santé à l'égard des Autochtones. Le fait que le gouvernement du Québec ne reconnaît toujours pas ça, est-ce que c'est selon vous un frein aux discussions qui vont avoir lieu au cours des 2 prochains jours et à compter d'aujourd'hui?
Ben, je vous dirais, d'entrée, c'est difficile de régler le problème si on ne le reconnaît pas. Le racisme systémique existe au Québec autant qu'il existe à travers le reste du Canada. Je vous dirais que ça n'a pas empêché, vous avez dit l'impact que ça peut avoir sur les discussions qui vont avoir lieu. Moi, je préfère mettre l'emphase sur les réformes qui se doivent d'être faites à l'intérieur du système de santé au Québec, à travers le Canada, dans toutes les provinces, pour enrayer ce fléau. Je ne veux pas présumer la mauvaise foi. En fait, tout à fait le contraire. Je présume la bonne foi. J'ai vu au sein du gouvernement Legault l'effort de vouloir reconnaître qu'il existe du racisme et d'essayer de l'enrayer, d'avoir des accompagnateurs culturels avec les populations autochtones, d'avoir cette sensibilité, par exemple, en ce qui a trait à la langue atikamekw. On sait que quand les gens sont à leur plus vulnérables, qu'ils s'expriment dans leur langue maternelle, alors un défi de taille en ce qui a trait aux langues autochtones, c'en est un parmi d'autres. Mais il reste beaucoup de travail à faire, je présume, la bonne foi du gouvernement du Québec. Et on travaillera avec eux tout en ne compromettant pas nos principes, c'est-à-dire celui de reconnaître qu'il y a du racisme systémique au sein du système de santé au Canada.
Merci, Émilie.
Oui, merci. Par rapport à l'agenda des discussions, je sais que la dernière fois, il y avait des centaines de participants, si je me rappelle bien, et c'était surtout, vous aviez surtout entendu des professionnels de la santé. Donc, pour les discussions qui s'amorcent aujourd'hui, pouvez-vous nous donner un petit peu plus de détails? Combien de participants? Quels intervenants vont plus prendre la parole?
Oui, merci, Émilie. La conférence, la rencontre d'aujourd'hui et demain est différente de nature dans sa structure. On a déjà une centaine de personnes de confirmées. La dernière fois, on avait beaucoup plus, mais c'était plutôt au niveau des témoignages des gens professionnels de la santé qui étaient autochtones pour partager ce vécu, pour partager, en fait, toujours dans le contexte du deuil de Joyce Echequan, alors que cette fois-ci, une réunion plus avec des objectifs plus concrets. On a demandé à la fin de la dernière réunion aux gens de penser à des pistes de solutions. Je ne vous promets pas un plan d'action à la suite de ces 2 jours, mais le focus qu'on a mis sur les participants, sur la nature, la structure de la rencontre, c'était de trouver et de pousser nos pensées collectives en ce qui a trait à un plan d'action puis des actions concrètes, que ce soit dans la juridiction territoriale, provinciale ou fédérale. Et donc, Valérie, je ne sais pas si tu voulais parler davantage de la structure de la journée, mais ça pourrait vous aider, Émilie.
Absolument. Donc, nous avons, c'est un événement bien sûr virtuel. Donc, nous avons des individus qui ont été invités en tant que participants, donc qui vont pouvoir intervenir durant le dialogue au cours des 2 derniers jours. Et donc, nous avons à peu près 250 participants qui ont été invités. Et nous avons à peu près une centaine d'individus que nous savons vont être interpellés spécifiquement pour partager leurs perspectives au niveau de leur organisation ou leur gouvernement. Mais nous avons aussi d'autres individus qui vont pouvoir prendre la parole. Nous avons aussi au-dessus de 600 individus qui ont été invités pour observer le dialogue et la rencontre. Donc, d'autres individus qui font partie des mêmes organisations et en plus qui font partie soit que c'est des experts, des chercheurs, par exemple, des représentants de leur communauté qui désiraient aussi pouvoir entendre le dialogue au cours des 2 derniers jours. Nous voulons vraiment avoir des conversations. Donc, on a invité des organisations autochtones et non autochtones qui font partie du système de santé canadien, ainsi que des représentants, bien sûr, au niveau politique des partenaires autochtones. Nous avons aussi invité les ministres de la Santé au niveau provincial et territorial pour qu'ils puissent aussi participer et partager leurs intentions et aussi, tel que mentionné par le ministre, des actions concrètes qu'ils planifient entreprendre ou qu'ils ont déjà entrepris dans leur juridiction. Donc, nous avons aussi invité des soumissions écrites de la part de partenaires et d'organisations à travers le pays. Nous avons reçu au-dessus de 30 soumissions écrites jusqu'à date qui ont été partagées avec tous les invités au dialogue national durant les 2 derniers jours. Donc, ça va permettre aux gens de vraiment regarder en plus de profondeur ce qui a été proposé par vraiment une très grande diversité d'organisations qui ont un rôle important à jouer au niveau de la réforme qui est nécessaire dans les systèmes de prestations de services canadiens.
Merci, Émilie. Prochaine question par téléphone.
Merci, thank you. The next question is from Rachel Gilmore of Global News. Your line is open. Please go ahead.
Hey, my question is for Minister Miller. I noticed today that story about the Pfizer BioNTech push to ask Health Canada to label the vaccine as containing 6 doses rather than 5. I understand that our contract with Pfizer is with respect to doses and not vials. Basically what I'm wondering is this change would allow them to send fewer deliveries to Canada? And I'm wondering what your reaction to that push is, and if you have any concerns about how that can affect our vaccine rollout.
It's complicated math questions on a Wednesday morning, Rachel.
It is.
But you're asking the wrong guy. You'd have to ask Minister Anand. I would have to check what the contractual terms are in terms of the doses. I expect Pfizer. I think all Canadians expect Pfizer to fully fulfill their contractual obligations. Our objective is to get as many doses as quickly as possible into the arms of Canadians, particularly those that are most vulnerable. I don't know if my colleagues. I read the same story as you did, Rachel, and had the same reflection, but I don't have an answer for you this morning. I don't know if Tom or no, we don't. Anyway, you'd probably have to direct that to Minister Anand.
Thanks, Rachel. Do you have a follow-up question?
Yeah, I would just push a little bit on that because, this could obviously affect the vaccine rollout for the most vulnerable as well. So I'm wondering if just personally you have any reaction to that push and whether you think that it's an appropriate push for Pfizer to be making.
I didn't quite get that it was an effort to reduce the number of vials, but really to increase the efficacy of what you can get out of them. I'd seen a similar report, I think, with respect to Moderna, but what you spoke about the most vulnerable, I highlight as a rule the most vulnerable in northern communities are getting Moderna. So that's largely unaffected with some of the nuances I raised with some of your colleagues in a much longer answer. But you know, I think we should all decry any efforts to shortchange us. But I didn't see that in what Pfizer was pushing. What I saw was something given in the context of a global undersupply, while respecting all the conditions to ensure people get the right level of immunity through a first dose to maximize output. So I think you're presuming a number of things that we have yet to confirm.
Thanks, Rachel. And we have just one last question. Go ahead.
Hi, Mr. Miller. This week, Lynn Bayak retired from the Senate. She had said for many years that there was good in residential schools, and even on the way out the door, she kind of reaffirmed that in her closing statement that she sent to the media. What's your reaction to her leaving the Senate, and do you think that she should get her pension, considering that she was suspended from the Senate previously?
We'll let Mackenzie, you're trying to get me to say.
Feel, Minister.
I want to say how I feel.
Well, go ahead, please. Share with us.
But there's a number of cameras in front of me, so I'll stay polite. What Senator Bayak said was unacceptable. Her actions have proven that she, I am someone, despite the fact that it is not politically expedient in politics, I believe in forgiving people. She's shown zero remorse. I don't forgive her. What she said was wrong. It continues to be wrong. To suggest that residential schools were anything other than to assimilate, layered with a religious fervor of the time to convert peoples that still have vibrant cultures, in some cases that have been ripped away from them. The trauma has been passed on through generations. Not to acknowledge that that exists and there's carry-on effects is the product of a twisted and closed mind. I wish no ill on people. I just, it's still sickening. So let the Senate deal with their pension. Seriously.
Thank you. That concludes today's press conference. Merci. Ceci conclut la conférence de presse. Merci.